Welcome to the National Association of Senior Move Managers Cornerstone Course on Safety. A course on safety. Sounds boring. But how can you be dedicated to assisting older adults downsize, relocate, or modify their homes if you are not also dedicated to keeping them safe during the process? Senior Move Management is not just protecting the client's belongings, it's about protecting the client as well. This NASM Cornerstone course describes best practices for creating a safe living environment for the client and people around them, and a safe working environment for you and your staff. Best practices refer to policies and procedures that have been proven to provide the best, most consistent outcome, with the fewest problems and/or complications. By incorporating best practices into your business, you are developing an organization that reflects both respect and accountability. Most people learn best practices the hard way, by trial and error. This NASM course helps you avoid problems before they begin. Publicity can provide recognition and credibility, but only if the story is positive. During this course, you will explore various safety issues through a series of headlines that illustrate what can happen when safety best practices are not in place. You may love seeing your name in print, but these are stories you hope you will never read. Don't dismiss any of these headlines as far-fetched. Virtually every one of these events has happened, and could happen to you and your business as well. Some safety best practice tips focus mainly on the client. Some focus on the safety of residents and neighbors, and some focus on the safety of senior move managers and their staff. Generally speaking, however, creating a safe environment for the client and their neighbors also creates a safe environment for the senior move manager. When safety best practices are in place, everyone benefits. Fall prevention seems so obvious that it would not require mentioning, but falls are a risk to which every senior move management client is exposed. 1 out of every 3 adults 65 and older falls each year. While some people recover quickly, 1/3 of those who fall experience moderate to severe injuries. 1 in 4 adults who suffer a hip fracture stays in a nursing home for at least a year, and 1 in 5 dies within 1 year of their injury. Many people who fall, even if they are not injured, become fearful of falling and limit their activity. This fear of falling ends up reducing overall fitness and actually increases the risk of falling. Why do older adults fall so often? There are multiple reasons. Balance, vision, and reflexes decrease as people age. In addition to these normal age-related changes, diseases that are common among the elderly often impact mobility, vision, and reflexes, as do medications for those conditions. On top of physical reasons for falling, there are emotional risk factors as well. Senior clients are likely to be stressed, distracted, and anxious. For all of these reasons, falling is perhaps the greatest single safety concern for senior clients. Fall prevention is not restricted to the client's home. Senior move managers often place used packing material in corridors and hallways outside the client's apartment. Corridors in many communities and apartment complexes are narrow and poorly lit. Other residents, especially those with walkers or scooters, may have trouble getting past the supplies. In addition, move managers often place supplies and trash in the community's trash room. Eliminating fall hazards is not just for the client's apartment. It extends to hallways and trash rooms as well. Packing supplies can become a fall hazard when left in circulation paths, both within the residence and in outside corridors and trash rooms. Keep floors free of packing material, and circulation paths free of packing supplies and cartons, even when the client is not present during the pack or unpack. Senior move managers work fast and multitask all the time. It is easy to miss a step due to cartons or debris left on the floor. Eliminating trip hazards doesn't just protect the client, it protects you and your staff as well. Electrical cords and cables can become trip hazards too. Since most senior residences do not have overhead lighting, 3 to 4 lamps per room are typically needed, so keeping circulation paths free of cords is important. Eye conditions common in the elderly impair vision, making cords on the floor harder to notice. Conditions such as neuropathy and Parkinson's affect balance and cause clients to shuffle along, barely lifting their feet as they walk. All of these factors contribute to falls over electrical cords or rugs that are not properly secured. Move lamps, radios, and computers close to walls so that electrical cords don't extend into traffic areas. Discourage use of area rugs in general, especially rug-on-rug. Become familiar with non-slip, non-skid rug liners, and discuss with the senior living residents how they handle rug-on-rug situations. One of the most difficult issues move managers face is when clients live in or ask you to create environments that you believe are too cluttered for clients' safety. Sometimes excessive clutter results because clients were unable to downsize sufficiently. Sometimes the new environment is cluttered because the old environment was cluttered. This is how the client prefers to live. Regardless of the cause, clutter that blocks circulation paths can lead to falls. The goal of furniture placement and unpacking should be safety and functionality, not decorating. Move managers should provide recommendations and suggest solutions that promote clear circulation paths. It is important to recognize, however, that clients have the right to make their own decisions, even if those decisions jeopardize their safety. It is not unusual for clients to have outdated food. Canned and packaged goods, and even frozen food, can be 2, 4, even 10 years old. Since senior move managers pack and unpack pantries, refrigerators, and freezers, they are often in a position to observe food labels and dates. Although outdated food is not necessarily dangerous, it could be dangerous and has likely lost its nutrient value. When food is outdated, bring it to the client's attention with a question like, "Is it all right if I discard food if I see it as outdated?" Most clients will be receptive to this suggestion, but do not discard food without the client's permission. Senior move managers are often asked to bring things down from the attic or up from the basement, so they are likely to be navigating stairs while holding things in their arms. Stairwells to attics and basements are often poorly lit or have burned out light bulbs. Handrails may or may not be present. Many clients have Bessler or folding stairs to access the attic. Folding stairs are a challenge when they are in good condition, but the folding stairs in many clients' homes have worn treads and missing bolts. Work in teams whenever accessing an attic with Bessler stairs so you can pass things down rather than carry them while on the stairs. Always use handrails when they are present and replace light bulbs if the current ones are burned out. Include extra bulbs in your toolkit in case the client does not have them available. Whether removing curtains or accessing high shelves, move managers are often on step ladders. Since move managers are often multitasking and working in crowded environments, they may be distracted or ladder placement may be compromised. Although many clients have step ladders, these vary widely in height and stability. Purchase a secure stepladder with a long handle and bring it to jobs so you have familiar and stable equipment. Make sure stepladders are placed securely and in locations that offer the easiest reach so you avoid awkward movements. If necessary, have staff members work together to monitor ladder stability. Let's face it, move management is physical work. Organizing, packing, and unpacking require constant bending and lifting. If you have prior back issues, you may want to assess whether you are able to be involved in work as demanding as senior move management. Make sure new staff members are aware that the work is physical. Establish policies of how many pounds you or staff should lift by themselves, and encourage staff to work together when heavy things are lifted. Provide in-service training for staff members on proper lifting and bending techniques. Animal companionship is wonderful for older adults, but pets can be a hazard for senior move managers and their staff. Unnerved by new surroundings or sensing the anxiety of their owners, Animals that are normally sweet and docile may act unpredictably. Cat scratches and animal bites are serious and prone to infection. You or your staff could end up in the emergency room. Medical personnel are required to report bites to authorities, so if there are repeat instances, the client's pet could be put down. It's important to think about the animal's safety as well. Small dogs and cats can be tripped over, injured by cartons, or get loose when doors are propped open. If clients are anxious about moving to begin with, imagine how they will feel if their pet is injured or lost. It is best to avoid contact with pets, especially as the move draws near. Although it's tempting to be friendly and helpful, never offer to coax cats into their carrier. For your safety and that of the pet, suggest that pets be boarded or with friends on pack and move day. People can be mentally ill or affected by substance abuse at any age, and seniors are no exception. As you tour a home, you may observe piles of empty liquor bottles. An elderly male client may insist that you go through his underwear drawer with him. As you sort through belongings, you may find boxes of pornography. In short, there may be signs that the individual has mental illness or a substance abuse problem. Move managers access areas of people's lives that are seldom available to others. You are invading their personal space, so always ask permission to open closets and drawers. If anything a client does or says makes you uncomfortable, leave. If a client seems strange over the phone, refuse the job or work with a team member at that location. Make sure your office or a family member knows where you are at all times. Guns are more common in some areas of the country than others, but weapons can be found anywhere. Most individuals who hunted have secured gun cabinets, but veterans with souvenirs from prior wars may have weapons that are not secured and have not been handled in decades. Don't assume that a World War II gun is not loaded or that its owner remembers how to use it. Most movers refuse to handle weapons or ammunition, and move managers should not handle them as well. Add this to your written contract and make clear that either the client or family members will need to be responsible for packing and transporting weapons. If weapons are to be sold, make sure the auction company is aware of their presence. If weapons are to be disposed of, contact the police and ask them to come to the residence. Many senior living residences have secure neighborhoods for individuals with dementia. Access to these areas is typically controlled by combination locks and/or ID tags, and doors are kept locked from the inside. It is common for movers to prop doors open when moving in and out of buildings. Residents with dementia have been known to wander out of doors that have been propped open. In addition, individuals with dementia are likely to become agitated when you touch their belongings and could become physically aggressive. When the move is to or from a secure neighborhood, it is important to station someone at the door to make sure no one wanders out. Each community has its own procedures. Check with the senior living residents to find out how they handle move-in and move-out situations. When packing or unpacking belongings of clients with dementia, try to have the individual not be present while you are dealing with their things. Virtually every kitchen has knives, so the possibility of getting cut while packing, unpacking, or sorting is present on every job. Pack knife blocks with the knives in them. If there is no knife block, create a sheath out of cardboard and seal the top and bottom. Avoid using tape on the blade of the knife. Make sure to label the carton so the individual unpacking knows that knives are inside. Some individuals who require oxygen continue to smoke, putting themselves, you, and their neighbors at risk. Clients who smoke while on oxygen are aware of the danger. They assume the risk, but you don't need to. If a client with oxygen tanks smokes in your presence, inform them that you will need to leave. Movers will not take oxygen tanks on their trucks, so clients will need to arrange with the oxygen company for tanks to be picked up and delivered to the new house. Oxygen concentrators remove oxygen from the air and do not pose a danger of explosion. Unlike oxygen tanks, movers can take oxygen concentrators on their trucks. Individuals who use concentrators typically have yards of tubing so they can move from room to room. Most seniors develop a sixth sense for knowing where the tubing is and do not trip on it. But individuals unaccustomed to the tubing, like move managers, can and do trip on it. If your client uses an oxygen concentrator, there will be yards and yards of tubing. As your client moves from room to room, the tubing moves with them. Try to always be aware of where the tubing is so you don't trip on it. Some bookcases lack stability, whether they are full or empty, because floors or carpeting are uneven. However, when bookcases are being loaded and unloaded, even stable bookcases can become unsteady, if not done properly. To maintain stability while packing and unpacking, weight should always be kept at the bottom of the bookcase. This means that when packing, remove books from top down. When loading, load books from bottom up. If the client's bookcase was bolted at the old location, assume this should be done at the new location as well. This generally needs to be done while the bookcases are empty. Keep shim in your toolkit and use it if the floor or carpet is uneven. File cabinets can become unsteady if too many drawers, especially top drawers, are open simultaneously. Conversely, bottom drawers left open can cause you, your staff, or the client to trip. As with bookcases, file cabinets should have the weight kept at the bottom. Pack file cabinets from top down and load file cabinets from bottom up. Never open more than one drawer at a time. To avoid tripping, do not leave bottom drawers open. Sometimes clients' homes are dirty. Clients may be unable to clean or may not see the level of dirt and dust. Cognitively impaired clients may be less mindful of dust. Caregivers may be mindful but too burdened to attend to housekeeping tasks. For all these reasons, the homes of senior clients may have dust mites and pet dander. Move managers who have asthma or dust or pet allergies should have inhalers within easy access. If your allergies are severe, you may need to have other staff members handle a particular job or refer it to a colleague. Some move managers stock breathing masks in their toolkits. This can be awkward if the client is present, since it implies that the air they routinely breathe is unhealthy. But if dust and allergens are severe, you may have no option. Sometimes clients' homes have pest and rodent infestation, the evidence of which is droppings. First, determine whether you and your staff are willing to work in the presence of rodent infestation. If appropriate, inform the client that you need to bring in an exterminator. Wear protective gloves and masks if you are working in a rodent-infested area, and dispose of any supplies used. For more information, review CDC guidelines at www.cdc.gov. Remember that all the websites you will see in the next slides are included in your handout. You can locate this additional information on the Safety Cornerstone course page on the NASM website. This page is the same page where you access this course. Blood-borne pathogens are microscopic organisms found in blood and bodily fluids. HIV, which causes AIDS, and hepatitis B are two of the most common blood-borne pathogens. Seniors who have been in hospitals and healthcare settings, such as nursing homes, may have acquired MRSA, a strain of staph bacteria resistant to antibiotics. All of these are serious conditions. Determine up front if you and your staff have adequate training in the use of universal precautions and whether you and they are willing to work in environments where these conditions are known to exist. According to the Centers for Disease Control, CDC, protective barriers are one of the main lines of defense against blood-borne pathogens. The CDC recommends using gloves, gowns, and eye and face protection whenever blood or other bodily fluids may be present, and washing hands before and after putting on or taking off gloves. For more information on CDC guidelines, go to www.cdc.gov. Even when there is no known evidence of blood-borne pathogens, universal precautions should be used wherever exposure to bodily fluids is a possibility. Plastic gloves should be worn when packing and unpacking items in bathrooms, or where cotton swabs and hypodermic needles are apparent. Also, never leave food or drinks where they could be exposed. Mold is found in virtually every environment, both indoors and outdoors. However, some people, especially individuals with respiratory conditions, are more sensitive to mold than others. A number of reactions from mild to severe can occur as a result of exposure to mold. As with blood-borne pathogens, it is appropriate to determine up front if you and your staff are willing to work in environments where these conditions are known to exist. For CDC guidelines on how to clean areas with mold and how to access mold remediation companies, go to www.cdc.gov. A carton edge, a utility knife left open in an apron pocket, or the tear mechanism on a tape gun can all cause cuts. Even minor cuts and scrapes can become infected. Let's face it, accidents happen. Include a first aid kit in your toolkit and make sure all injuries, however minor, are treated immediately. Establish hand washing as a routine practice and make frequent use of disinfectant hand cleaners. Get a tetanus shot every 5 years and require staff members to provide evidence of a tetanus shot every 5 years as well. Adopt the policy of completing an incident report whenever you, the client, or a staff member is injured. An incident report establishes a record of what happened and can be important for workers' compensation, health care, and legal claims. A sample incident report is included as a supporting document for this course. We chose to put these slides last because these 3 things, first aid kit, frequent hand washing, and incident report, are simple and low cost to implement, but are among the most effective tools in minimizing risk and infection. As business owners, we owe our staff the same consideration for safety that we provide clients. Maintaining a safe work environment reduces potential workers' compensation claims and communicates to staff that they are as important as clients in achieving your company's mission. This NASM Cornerstone course on safety is based on the principle that being a senior move manager is about more than safeguarding the client's belongings. It includes maintaining a safe environment for the client before, during, and after the move, keeping their neighbors safe, and creating a safe work environment for yourself and your staff. Safety is everyone's business. The best way to create a safe environment for clients and people around them, as well as for staff, is to train every staff member in safety best practices. Safety is an area where every business owner must walk the talk. You cannot expect staff to take safety guidelines seriously if they do not see this behavior modeled by you. Congratulations! You have completed the NASM Cornerstone course on Senior Move Management Safety. Please proceed to the assessment. You can access the assessment by logging back into the course and clicking on the assessment link. On the same page, you can also access supportive material. Thank you.